So hi everyone, here we are at the Ben and Gary Show. We know dentistry, and here we're always answering your questions, and we're here for another episode. And we had a question that came in recently that said, "Does my smile make me look older?" Interesting question here. I guess it depends on who's asking it. If my wife is going to ask me that here, I probably will refer her to someone else because I'm not going to answer that question.
Good
and I
idea.
will probably say, "No, dear, but you might want to get a consultation." So if you were, you probably would come to someone like us. And so that's some of the things I guess I would think about when Gary, when someone mentions that, what kind of comes to your mind at first in terms of like what could potentially make your smile look a little older, or just facial features.
Yeah.
And obviously our smiles are things that we deal with.
Gosh, man, it would have nothing to do with the wrinkles around your face, right? But that's another subject for a
Right.
plastic surgeon. But no, a lot of times we'll see just the incisal wear of the teeth. Just the teeth wear down over time, and
So the front teeth look a little shorter.
they look shorter. Yeah, a lot of times they'll have some fracture lines in the enamel. They tend to look darker.
Yeah, especially if
right?
you look at them really closely, and we have on our magnification, you'll see
Right.
these things called craze lines in them, which
Right.
tend to, I guess those things are attributed to stress and force on your teeth, which is also contributing to the wear,
Right.
making them look shorter.
And other times you can have gum recession, so the gums recede and your tooth looks longer.
I mean, you get
So-
longer in the tooth. That's sort of where that
Yeah.
that old adage, that old saying comes from.
Right.
But it's true, and so those are things that I think that can make your smile look a little less youthful.
Yeah.
So-
So then what do we do to maybe fix it, right? So,
Well, I think it's like, what does that look like?
the wear?
Yeah, I
Oh,
mean, sometimes
there's-
people's
yeah.
smiles, instead of kind of following the lower curve of their
Right.
lip, it
Yeah.
goes the other way, like sort of the unhappy smile look.
Right.
It's referred to as sort of the reverse smile line. The smile line being the curvature of your lower lip. The
Right.
edges of your teeth should kind of follow that as you're smiling. If you have sort of the straight across smile like me.
Yeah.
Then you're going to potentially see something like that. If you have someone who really kind of curls their smile up, and that's how their facial muscles work, then their smile is going to want to kind of
Right,
follow that
yeah.
here. So that's why they call it the smile line. If it's not contiguous with that line, it can throw
Right.
you off. It throw
Yeah.
out the visual
Oh, yeah.
the cues there for you to be able to sort of think the smile looks good.
And what's interesting is when you have that, a lot of patients tend not to smile as much.
This is so true. Yeah.
And they become very self-conscious.
They
about
hide it,
So
mask it.
yeah, they very creative ways to mask their smile.
Right.
Yeah, they sometimes cover their smile with their hands, or they'll just kind of purse their lips. Yeah.
So Monday morning,
Yeah.
patient walks in, you have a
Yeah.
consultation about their smile. They say, "You know what, I look in these pictures here, and there's just, my smile just doesn't look
Right.
like it used to.
Right.
What can we do? What's going to be your first step that you're going to consider in that situation?"
The first step I would consider is just lightening your teeth, doing some bleaching. I think that tends to do a lot just to improve
Absolutely.
your mindset, really.
Well, your
You know?
whiter teeth are going to be associated with more youthful look.
Right.
A younger individual, they haven't had an opportunity to, have all the things that are
Right.
vices in life here. Red wine, potentially smoking, and coffee, tea, things like that.
Oh,
That would
yeah.
actually
Yeah.
it cause stains into your teeth.
Right. Yeah.
Just getting a whitening is almost like taking an eraser to it and sort of
Right.
starting over here,
Oh,
which is
yeah.
pretty cool.
Yeah. Sometimes we get patients that come in with really very nice teeth, but they're just dark or darker.
Darker, yeah.
And they'll say, "Well, can I do veneers?" And I'll think, "Well, gosh, you have the shape and the integrity of the tooth structure is still very nice." And so
We like to
obviously
save
bleaching
save
is-
teeth, and
Yeah,
doesn't
bleaching's
hurt
like
your
a
teeth.
Nice answer, nice treatment to go to.
Right.
And once they're done, oh my gosh, they're so happy and they look great. So
Yeah, it's one of the coolest
Yeah.
things I can actually tell myself, and I love to be able to do. It's really instant gratification for not only for the patient but also for us. We really want to
Right.
help somebody be able to achieve their dental goals, and there's nothing cooler than being able to, in like one visit, in an hour and a little bit of time here, to be able to have an in-office whitening process that would really kind of turn the clocks back kind of instantaneously, and there is a wow factor that I just love to be able to see, and it really gives me a lot of gratification when I can do that.
Exactly.
Now,
So,
if perhaps they whiten their teeth and they're having this
Mm-hmm.
youthful, sort of turn back the clocks feeling, there can be some additional things that they may want to have done, because it doesn't really do anything about the wear.
Right.
And it doesn't do anything about the getting longer in the tooth concept
Exactly.
of the gum recession. That's when we have a lot of things that we can potentially do, whether it be a veneer or sometimes crowns,
Right.
and those can be done as well, and sometimes even orthodontics. Getting teeth, because as time goes on, teeth are dynamic and they will move, and they're going to want to move forward and crowd forward, and so that can actually make your smile look even a little bit older.
Right.
So the idea would be try not to go with like sort of instant orthodontics, meaning veneer everything even though teeth are still crowded. The idea is to unravel your smile, unravel the crowded nature of those teeth, and then consider some sort of composite or either a bonding or a veneer or even a crown.
Right.
So there are definitely things that we can do.
So you did some Invisalign, didn't you?
I did do some Invisalign.
Yeah.
Don't I look younger?
10 years younger. I know you're younger than I am. So.
Yeah, it's such a cool process, and it's easy to do. There is. It's technology driven, and it's awesome to be able to see the results or the potential results before you actually do it, which I find that with Invisalign is one of the key factors on being able to incentivize an individual to want to move forward with treatment. And it's great for adults because you can take them out when you need to, in terms of eating out at a restaurant. And if you have to public address or public speaking, you can take them out then. But it's a matter of being able to maintain the process while you're getting the just conducting life. So Invisalign is a great way to be able to do it, and they make some of the most awesome custom bleaching trays, whiten trays. And so as you're even going through Invisalign, it's possible to be able to use that as your means to be able to whiten your teeth while you're straightening them. So after that, it's a matter of considering something else. If you're okay at that point in time, sometimes whitening just might be enough.
Yeah. Well, that's great then.
So it was cool. It definitely worked out well for me. But I do have to say is that you have to be very compliant with it.
Right. Yeah, that is true.
It's very easy to be able to not use them for the prescribed amount of time, and then you won't be able to get the results that you're looking for.
Right.
I know we've addressed this in other episodes about Invisalign and whitening, but boy, it's really changed our perspective on what we can do for patients, and it really is being able to make sure we're putting the cart before the horse in this situation.
Yeah, I think it's very cool.
Yeah. So I think we've kind of covered the ways in which we can
improve your smile,
improve people's smiles and sort of diagnose why maybe certain individuals' smiles might not look as youthful as they once did. I believe also too, there's one other subject. I'm sorry, a factor we didn't talk about, which was, how to correct that long in the tooth look. There are opportunities with a periodontist, partners with us that do certain treatments that can, almost be like periodontal or gum plastic surgery to be able to, give that youthful look and not look so long in the tooth anymore.
Right, and now they have newer techniques and. That are they're less invasive and can achieve the same thing, and I think it's called the Chow technique.
The Chow technique,
the pinhole technique.
It's just a much, like you said, less invasive process, and you can actually treat larger areas than you would have the more traditional way, which was to take some of your own donor gum tissue from one place and move it to another. That's probably another subject for another time.
Right.
But we've just touched upon, I think, an opportunity to have another subject on the idea of periodontal plastic surgery. What is that? That's going to be for another episode.
Yeah.
But at this point in time, we're the Ben and Gary Show. We know dentistry. We'll see you next time.
Bye-bye.
Bye-bye.